Hello, my name is Brett Stam, and the vulnerable population we'll be focusing on today is the incarcerated elderly and the health concerns that go along with that group. So let's get started. So, the first thing we need to do is define this population. Those that are confined or imprisoned, obviously, are the people we will be focusing on here. Those of over the age of 55 is a general consensus. As far as those that are considered elderly and incarcerated. This does happen to be the fastest growing prison population in the world. 280% increase in the U.S. alone over the past decade has been seen in this age group. These individuals, it should be noted, face health concerns that are in line with those 10 years they're elder in the general public as well, which is also of interest. The population itself, 8% of those in the Salt Lake County Jail currently are over the age of 65. That is in comparison to 10% of the state prison population, which 10% nationally is the level that it coincides with as well. Interesting enough, internationally, there is no compiled data. So what we can see here is locally that we have a slightly lower amount than the national and statewide level. Some things to think about that contribute to the social determinants of health for these individuals is poverty, chronic stress, poor nutrition, and both social and environmental conditional degradation are things that are of concern for this population. So things that attribute to those would be the individual's inability to earn income generally while incarcerated, the fact that they are not able to have jobs. It's a very defined peer group because of their age and physical ability and sometimes cognitive ability, which can hamper their ability to form a peer group. And so the peer group they're forced to be in sometimes may be hostile, if existent at all. They have very limited control over their diet, and the environmental conditions are also out of reach for them to control or to affect any kind of change because they can't control the temperature and cleanliness, things like that. In line with the poor health practices, their diet is typically cafeteria food. There are very varying limitations as far as type of diet for specific health concerns. Smoking is very common in the prison system. These individuals live in overcrowded systems, generally speaking, where there's a lot of people and not a lot of room for individuality. They're deprived of a lot of social factors because of their housing as well. They tend to be witness to or victim of violence. Substance abuse is common inside correctional facilities. Chronic health conditions is a big one because it is things that affect individuals before they're incarcerated as well as after. So not just the fact that the medical care while in the facility is of varying degrees of quality, but also the fact that before they come to jail, typically they're not taking care of their medical conditions. If you look, however, at the hierarchy of needs that Maslow set up, most of their physiological needs are being met. However, there's always a constant underlying threat that those needs might be minimized or taken away. They are provided with general safety and security. Friendship is attainable through the peer group if you have it. There is a general morality, kind of a code, if you will, while in prison, which is going to differ from maybe what we would think of as the morality in the general public. And most people have accepted the fact or the reason that they're there. So they do reach that level of self-esteem. Unmet, typically, sex is one of the physiological needs that is not met. They're not able to have jobs or incomes typically. Access to family is a big problem, especially if you're housed in a facility maybe far from your family you have access to, and that's only if you're allowed to even have visitors. Achievement is not something that's there's not a lot of goals or a lot of things that they're typically able to reach while in in jail or prison. And spontaneity, your habits, your patterns of life are already picked out for you for the most part. So this makes it very difficult for them to ever reach the self-actualization level of the pyramid, though it is still possible. And to meet basic needs, like I said, is always threatened. These things can lead to the fact that there's always an underlying threat to your safety, so mentally and physically you tend to decline. Some communicable diseases that are of issue while incarcerated, especially for the elderly, would be tuberculosis. You're living in close proximity to individuals. A lot of those individuals come off the street inside the facility or inside the community. If there's not great monitoring, when those people transition into those correctional facilities, there's a higher instance of exposure. That is in line with HIV, AIDS, hepatitis, STDs. Those things are problematic due to IV drug use, to at-risk, risky sexual behaviors as well, can contribute to those. Things that could help to mitigate those things would be obviously testing for those coming into the facility, education of both those before they come into the facility and those that are after to really help minimize the spread of those if they recognize or are diagnosed with things so those things aren't shared as easily. Inside the facility, coronary artery disease, stroke, and cancer are of great concern. These individuals have little ability to exercise, to move around a lot, and to control their diet, things that would help minimize these diseases. Now, obviously, the opposite would be true. To help mitigate those things would be giving them healthier options, increasing time for physical activity. Education, again, is key. Those people do not know, maybe they aren't aware of the appropriate healthy behaviors to develop before they're even in the facility, in the community. Inside the facility, self-care for those of elderly is a big concern. Suicide is the number one cause of death in these prisons. Individuals are exposed to stress, both acute and chronic. They often are faced with traumatic episodes of things that they are victim to or witness to, and long-term, just the lack of all those needs being met eventually can take its toll from a mental health perspective. Now, when someone comes into the facilities, they need to have an individual mental health assessment, having increased staffing, people being there, frequently seeing them, watching for patterns of behavior typically, and having more better trained staffing so they can recognize those things. I know at my work specifically, we do undergo mental health, suicide prevention training, so we can all know what signs to look for. Providing these individuals, when they get to be elderly, with potential geriatric or medical releases, can also help to minimize the potential for these self-harm or decrease in self-care. This population does tend to be less likely to harm other people because of their age, their physical ability, their general acceptance potentially of where they're at. However, they also are increasingly vulnerable because of that, conversely, when it talks about their physical ability. The reason they're there a lot of times, 1/3 of these individuals over the age of 65 are sex offenders, and they are targeted by the general population. So that increases their risk. Placing these individuals in potential protective custody situations can minimize this factor. Some people have discussed forming, and some facilities actually have geriatric-only sites, and like we spoke about earlier, compassionate release, geriatric release, those kind of things could minimize them being increased staffing, people watching those individuals, making sure they're not being victimized, could also help in this effect. So, in summary, the population is exposed to lots of determinants of health that can make it difficult for these individuals to function and to meet their needs inside the correctional facilities.